I am Calum MacRae. I'm the Chief of the Division of Cardiovascular Medicine at Brigham Women's Hospital. The division is part of the Department of Medicine that's focused on the diagnosis, management, and follow-up of all types of cardiac and vascular disease. And we also have a very deep research program that runs all the way from the most basic through to the most clinical types of research that covers the entire spectrum of cardiac and vascular disease. The mission is really to understand disease better and to use those insights in the effective treatment of patients with cardiac and vascular disorders. We know that despite the fact there's been a huge amount of work in this area, cardiac and vascular disease still remains the most common cause of death and morbidity in the developed world. And so there's a need to really understand cardiac disease much better and vascular disease much better and develop new and creative approaches to managing those disorders. In addition, we have front and center as part of our mission the management of complex patients with existing state-of-the-art care. And we have many programs that are of national and international importance in disorders that range from the inherited forms of heart disease all the way through to advanced heart failure, areas where we have had long and deep experience. Team's philosophy is really to be very patient-centric, to be based on the needs of the individual patient, which are often very unique and distinct. And so what we have tried to do is to make sure that we really have at the focus individual patients, individual families, and we try and understand what's going on in a very granular way in those individual cases and bring to bear the very best of medical, surgical, and nursing technologies to really help the patients get back to quality of life and long-term survival. One of the great strengths of the division is that of the 150 faculty, almost all of them have their own research programs as well as being very active clinicians. And so we are able to bring research from the bench to the bedside and from the bedside to the bench in a way that few other places are able to. We have research that ranges from the very most basic drug discovery and genetics all the way through to very large clinical trials. I think what we're seeing in the setting of large academic medical centers like Brigham Women's Hospital is a need to offer much more value, a need to deliver state-of-the-art care on schedule to patients in their homes and in their communities when it's needed, but also to be able to offer completely transformative care that can only be delivered in places that have an intense and long-standing research operation.